Good, Bob. You don't need to keep sharing your screen yet.
Yeah, you're going to take it off now, aren't you, Bob?
Oh, I don't know. You know, I'm new to this stuff here. I'm sorry.
Okay, you're live now.
I feel alive now too here. That's good.
Like we got about 1 minute. Okay, I have 10:30. We'll call a meeting to the order of neighbors of Dunn County. Roll call. Shows everyone is here present along with Chair Bartlett. Everyone should add a chance to check out the minutes in your packet. Is there a motion to approve?
So moved.
Moved by Kelly, second by Steve. Is there any questions on the minutes? Hearing none, all those in favor of approving, say aye.
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 Opposed, same sign. Carried. Do we have any public comment, Krista?
There's no public comment.
Okay, thank you. Carmen, we'll start with your administrator's report.
All right. First and foremost, as always, we do Quality Assurance Steering Committee updates. So as always, we met this month for quality assurance. We discussed the things that we always go over. And then this month on the agenda was our quality indicators. So those are given to us by CMS for every building. They're quarterly given to us, basically shows us where we sit for all of our quality indicators, such as falls, wounds, infections, anything that could show quality. And we review those every 3 months at our Quality Assurance Steering Committee. We went over those. There was nothing overly alarming. We had a couple of our buildings had an increase in falls. We review those and look at, was it something concerning? Is it something that was one resin that fell a bunch of times? Things like that. So we went over those for all 3 of our buildings. And then we spent a lot of our time at QA on COVID, which we'll talk about a little bit later. But most of our meeting was related to COVID and the changes that we anticipate post-vaccine and things like that. Is there any questions about QA? Okay. Next is the employment activity report. So I'll have Chris discuss that.
Morning, can everybody hear me?
Yes.
Okay. So for the month of January, you can go through the types of recruitment. We did do a Facebook push, which wasn't overly successful. So for the month of January, we had 6 interviews. We scheduled 6 interviews held. We offered 5 positions, of which 4 were accepted. Those are all basically CNAs that were hired that month. If you go down to the resignations, we did have 4 CNAs that had resigned. So it was kind of the new hires and the terms are kind of a wash. We didn't end up, ahead with staff. It's kind of at a break even. If you want to go down, then you can look at the open positions. So those were just kind of tweaked with the number of, people coming and leaving. Wouldn't have been much change from last month because of the new hires and the people that had left. I'm going to go down to the leaves of absences. We don't have a whole lot of leave of absences for like full-time staff. We do have obviously, the 8 part-time staff that are on, an educational type of leave. If we go down to work comp lost hours, we didn't have any time lost injuries for the month of January, which is good. Then if we want to go down to the red italicized on the bottom, we had roughly 60 shifts missed due to COVID related issues, or roughly 480 hours of lost time due to COVID.
We did have a bit of a spike in the COVID last time because of one employee has been out for quite some time with COVID. That was a full-time employee as well. Not COVID herself, but her children have had COVID, and it's been one kid after the other. So then her quarantine keeps extending. So that has caused one full-time employee to be out for an extended period of time, in addition to our random ones that pop up that are out for either the 14 days for quarantine or 10 days because of COVID positive. So that added some hours to that as well. Kind of on this note as well, we did look into what was requested from last month in the wage study between us and other nursing homes or healthcare centers. So Chris did start that process with other county homes. So we're working on that and then working with HR with that as well to get a more in-depth study. But we did survey the other county homes that would offer up wage analysis and things like that as well. So we are working on that process too, as requested from last meeting. In comparison to some of the county homes, we are pretty similar to a lot of them. I think the one thing that is very different in our market compared to some of the other county homes is that we have non-nursing home competitors. We have more hospitals in our area than some of the rural county homes that we're comparing ourselves to in that study as well. So that we'll need a little bit deeper of a dive of a wage analysis to compare against Mayo and Sacred Heart and some of the other competitors that we have for employment. Any questions on employment?
Supervisor Kinnear, Mr. Chair.
Yes, Mike.
I'm just curious, the resignation reasons, it said unhappy with mandation. Could you explain that, please?
Sure. So when we have a call-in or we have an issue that a staff person either doesn't show up for a shift, there's a call-in, we have to send someone home, say someone tested positive, some reason that a shift isn't full, we have to have staff to take care of the residents. So we try to do it in a way that's fair, that we rotate who's getting mandated. We ask first if anyone would be willing to stay. But if everybody says no, we do have to, it's called mandate someone to stay to fill the shift, because we can't have shifts unfilled. We try our best to cover it, but at some points we do have to say, I'm sorry, but you have to stay. And that employee was not happy that it was her turn to do that.
Okay, thank you. And that's tied in with, if people do it voluntarily, they get a bonus, don't they?
Correct. And they also do get mandation pay if they're mandated. So it is, it's a different kind of bonus pay kind of thing, but they do also get an incentive if they are told they have to stay. But people still don't like that very much. Any other questions? Okay. Next is the resident referral report. So we are happy to say that we were able to admit this month in all 3 neighborhoods. So that was exciting. That was the first time in quite some time we've been able to admit to Central. So at the beginning of the month, we started out at 103. We had 42 referrals. We had 12 admissions and 30 that did not admit. So we're still not back up to where we were like pre-COVID and all of those things, but we are seeing an increase, which is good. We had 1 person who was COVID positive in their infectious period. We had 4 that we were not the first choice. 3 went to swing bed, and then 1 went closer to home. That is the same scenario of hospitals are referring to places that are well outside of their traditional region kind of area because nursing homes can't accept if they're in outbreak. So we're getting referrals from places that are significantly further away that the resident or the patient at that time would rather go somewhere closer. So they wait until there's a place closer to home. Not in network with insurance, we had 5. 4 expired at the hospital. 9 went home. We're still seeing that as a big trend of people would rather go home and be cared for in their home than in a facility right now, for obvious reasons of risk of COVID, as well as visitation restrictions and things like that. They would rather go home. And then we had 5 that had no payer source. So at the end of the month, we had 108 residents in the facility, which is still below our budgeted mark, but still improvement from what it was before, as well as we continue to get admissions now through the month of February. We have been increasing more than that as well. We had 0 residents transferred to other facilities. We had 3 deaths and 4 discharges. So it was starting to see an improvement. Admissions to Central is a big part of that, as our outer buildings have stayed pretty full this whole time. Arrowhead is still closed. We are admitting to Fireside now. So that is seeing some uptick in that. It is a balancing act of admissions and staffing. If we go above a certain number, we have to add another staff. So it's a balancing act of when it is fiscally responsible to go above a certain point and staff that position as well, so that we have enough staff to take care of residents, but don't have too much staff for if we have lower census as well. So we're in the process of doing that balancing act and having it work out. So. Any questions on referral activity? Okay. Move on to environmental and facilities report, and Scott.
Good morning, everyone. I guess I don't have a huge amount on a report. I want to mention that I was out on quarantine for a couple weeks because my wife ended up testing positive. Our facilities guys made it very easy for me to work from home those days. We did everything by email or text or cell phone, and they made it very easy taking care of everything while I was out, handling it that way. Everything with the sub-zero temperatures has been going good. A few areas a little bit cold on in the buildings, but we addressed those pretty quickly and working on getting things taken care of. Other than that, the snow removal has been going good. Everything getting taken care of well there. Otherwise, the guys have been working on the preventive maintenance and work orders, anything that comes up. So if anybody has any questions, feel free to ask. I can answer them for you.
Just one small question. I see that we have pest control on the vouchers again. Is that an ongoing thing, or is there a problem? I thought it was ants or something last time.
We have pest control that comes monthly, does a service. We have a contract with them.
Thanks, Scott.
Yep.
Don't have to worry about shoveling the roofs off this year so far anyway, huh?
We have not had a problem with the roofs. We have not had a buildup of snow, so that is a good thing.
Yep.
Yeah.
All right. Any other questions for Scott? All right. Thanks, Scott. All right. Next is vaccine administration. So our last meeting, we had our first vaccine clinic, and now we have had our second. We are very pleased with how that has gone. Our second vaccine clinic was on February 1st. It was done by Walgreens again. They were on site for the whole day. We had 198 people receive a vaccine on the 1st of February, which kind of put us up to 211 people who had received 1 dose or more of the vaccine. So we did have 13 individuals who received their first dose at our first clinic who didn't get their second dose at our second clinic, either due to they forgot, they were on quarantine, currently tested positive, or other reasons why they couldn't come in that day. but they will be able to get their second dose on our third clinic, which will be on March 1st. So it went very, very well. We have over 90% of our residents have been vaccinated. We have a handful that did not want the vaccine or their families did not want the vaccine, but we are happy with about 90%. And then depending on how you calculate the numbers, because we do have some staff that can't receive the vaccine due to age, and some staff that are on school leaves or any other kind of leave that are still on our staff list, but really wouldn't come in because they might be in a different state or whatever it might be. We're about at the 65 to 70% of our staff received the vaccine, depending on if you take those people out or not that couldn't get it or weren't going to be local at the time. So we're pretty pleased with that. We will have the third clinic on the 1st to get the second doses for all of the people who had gotten the first dose. Kind of wrap that up. It'll be a shorter day because the majority of our people who are vaccinated have now received both doses. The vaccine clinics have gone extremely smoothly, so we are very happy with our partnership with Walgreens. For ongoing vaccination, we have registered as a vaccinator. So similar to public health that went through the process of becoming a vaccinator, we have done that process as well. Currently, they are not sending vaccine to new vaccinators, so we would not be able to request vaccine at this time. But once they open that back up, once there's more stock of vaccine, we'll be ready to have that, since we've done all of the application and training and all the different parts that you have to do to become a vaccinator, so that we're prepared for it once we can do that, so that we can vaccinate new residents, new staff, and go through that process. Any questions on vaccine? Nope. The only other thing I'd add about the vaccine is that we did have a couple of people that had reactions to the vaccine. We did not have any immediate reactions or allergic reactions, just typical vaccine reactions that people were feeling off for a day. Some had, the majority of the complaints were arm pain, but some had some symptoms of being tired, headaches, just not feeling great. I personally didn't feel great after it, but that is a very common response, and it means that your body is doing what it should do and building an immune response. So in most people, I think everyone we had that had a reaction, it was gone within 24 hours. So all in all, it went very smoothly.
I have a question.
Sure.
So you're saying no one has had the second shot yet?
No, we've had almost, I think it's 170 people had the second shot. So the majority of our staff and residents have had 2 shots. We just had 13 people from the first clinic that had their first and didn't get their second. And then we had anyone who got their first shot on our second clinic would need their second shot, but most people have had both.
So no one's had a severe reaction from the second shot at all?
Not a severe one. Like I said, I didn't feel great, and there was a handful of other staff that reported not feeling great. And I'm sure there was more that just didn't say anything about it. But it's about 24 hours that you kind of feel off and tired, headache kind of stuff. Very typical vaccine responses. It's just your body building up an immunity, but we did not have any like allergic reactions or any severe reactions. And for anyone who did have a reaction, they felt better within 24 hours.
Okay, thank you.
Mm-hmm. Any other questions about vaccines? Okay, I will move on to COVID in general. So we have had a lot less COVID activity in the last couple of months. Right now, we have 1 staff member out with positive COVID-19. That was as of yesterday. So they'll be out for 10 days. So the East building is currently in an outbreak. We will test residents and staff. We're continuing to test staff on a regular basis anyways, and then all the residents in the East Building will be tested due to potential exposure from one staff member. We have been able to open indoor visitation, which has been awesome. We started that this week due to the county's positivity rate dipping below the 10% limit. So we've been able to have families in the building, which has been amazing. It is very similar to our outdoor visits where it's scheduled, it's monitored. We keep families 6 feet apart from the resident. We also have a plexiglass shield. The families have to wear masks. We try to have the residents wear masks if they'll tolerate it, or if they are safe to wear a mask. And they are going smoothly so far. Unfortunately, because of the positive staff member in the East Building will not be able to do the indoor visits for a minimum of 14 days because we are technically in an outbreak. But after that 14-day period, if we don't have any more positive cases, we'll be able to start rescheduling the East visits at that point. So we are just starting that 14-day period. Today would be the first day. So hopefully in a couple of weeks, we'll be able to start East visits again. But so far the Central and West ones are going smoothly. Anybody have any COVID questions for me? Okay. So we kind of touched on this a little bit already when we were going over the employment activity report, but the nursing wages. So we have been talking about this for quite some time about comparing nursing wages with agency wages as well as with the other healthcare entities in our area and other county homes. As I said, Chris had reached out to his counterparts at other county homes, and we did get some feedback from that of wages for both CNAs and nurses. For the most part, we were fairly close to a lot of them, with the exception of some of the buildings that are either in like the Madison area in higher labor markets, and some of the ones that have psychiatric facilities, those would have higher wages as well. So we were fairly close to most of them. But as I was discussing earlier, comparing to somewhere in the rural area that doesn't have other healthcare entities nearby is also a little bit different to us than when we have local hospitals, other local nursing homes, clinics, and other places that employ healthcare workers that also pay higher than a nursing home might. And that's where we're really seeing our highest competition. A lot of our CNAs or nurses that leave for other employment for higher wages are going to Mayo. They're not necessarily going to another skilled nursing facility. So comparing to them is potentially what we need to look at. Unfortunately, when we just kind of did a less specific wage study of more or less looking at their job postings, when we compare to hospitals, they are significantly higher and to a rate that may not be doable because they're about $10 higher than some of ours. So that's something that we need to work a little bit more with HR, and we're in that process right now. So just comparing ourselves to other nursing homes may not really be the answer as well. Any questions on this?
Mike?
Yeah, thank you. Now, we have been talking about this for some time, and I had a conversation or email, or I can't remember what, with maybe Carmen. An example of wage differential is the pool people got paid a COVID bonus, where the regular staff doesn't get anything like that. And so that's got to affect morale. It affects lots of different things. And I think Carmen and your staff are doing a great job. I'm concerned about our committee and what we've communicated to you. When you were hired, I think the main emphasis was you got to bring the the money in and cut the expenses. And we still have to do that, but I hope as a committee, we're not tying your hands and telling you can't spend anything. Because there are some times, I think, when it's either just right or it's necessary to spend some money. And I'm thinking it's been over a year since the pool staff has been getting a COVID bonus. And if I was a nurse and I'm looking at somebody getting a bonus, I'm saying, wow, maybe I will move over to Prevea, or maybe I will move over to here. So
Yeah.
I hope our committee isn't tying your hands. I'm not, there's nothing wrong that you're doing, but I'm talking about our committee. I hope we're not tying your hands and limiting you, because sometimes you have to spend money to make money, as they say in the business.
So we are actually in the process of working on a COVID bonus. It's a little bit different than what agency did, because they did it when they were working with a COVID individual. So they got bonuses if they were in a unit with COVID positive residents. So ours is going to be more of a across the board. It doesn't matter if you were working in East where we had COVID residents versus working in a different building, because even if you weren't working directly with the resident that had COVID, with the more of the hazard pay kind of style that agency did, it still affected everybody across the board, simply as having to wear extra PPE, working extra shifts, filling in. So we actually are doing that. It'll most likely hit the Committee on Administration, not this committee, next month is the goal. So it'll go through, since it is more of an HR thing, it is going through Committee on Administration. So we're hoping to have actual bonus checks to people. I believe our goal was May, because it'll have to go to Committee on Administration, Executive Committee, and County Board. So we are in the process of that. Heather and I and Jenna met on this on Monday, and Keith and his team has been involved in this as well. So we're hoping, especially to use some of that COVID money as well, to make those significant bonuses for staff that has worked through the pandemic. And we're working on making it a tiered approach for people who, maybe anyone who is working full-time and above or putting extra hours in, and then doing a tiered approach for people who were here for the year as well, to not miss people that maybe like our college students that work all summer long and put in just as many hours then as we do now, so that they're included as well.
Yeah, I think it's good to hear that, and I hope we didn't slow it down, because that's a year and a half later. But keep in mind that at least one member of the committee is thinking sometimes you just have to spend, and it's okay to do that. I know we're looking to be in the black, but and also Chris, I think, was kind enough to share what we pay the pool people, and not the pool people, I'm sorry, the pool agency. And if Chris could share that with the entire committee, that'd be kind of nice.
Sure.
So that it's the beginning of information we'll have, so we can look at the nursing wages. I
Yes.
appreciate that.
Yeah, so Jane and I and Chris have been discussing that over the last couple of days, because we were looking at doing the full comparison between the two, and looking at the full cost of an individual here, with WRS and life insurance, like all the different things that we make the cost of an employee off the PEP spreadsheet, and comparing that to agency, and that total amount that Chris had sent over to you. So I believe Jane and I and Chris were going to have it all finalized after this meeting and send it out to everybody. So because we had it pretty much done yesterday, and then realized that when we were looking at it, Chris was looking at numbers of hours in a month, and Jane was looking at billed, which switch a little bit depending on billing schedules and when checks are cut and things. So our numbers didn't match up. So we are hoping to have it ready for this meeting, but unfortunately we were looking at two different numbers. So it should be done shortly after the meeting today.
Well, I appreciate that. And, I just asked you for that information just yesterday. I did not expect it for today. But yeah, even if we get things that aren't totally accurate, but they're close, it gives us an idea. So, and I know you've got so much going on. I hate asking questions that get you do things, but I guess that's our job, to give you extra work. Thank you,
No worry
Carmen.
at all. Okay, any other questions on the nursing wages? Okay. Next is census. As I said earlier, we were going up in census, which is great. We had consistently been going down since we weren't taking admissions. So we have been increasing. We have had a couple of long-term deaths in the last couple of weeks. So we do have a couple of open beds in long-term care that we are looking to fill as well. Primarily looking through our waiting list for the long-term care beds, as well as we do have a couple of our short-term residents that plan on staying long-term that we will move from our short-term rehab into our long-term beds, and then filling up our short-term as well. We've had an increase in the fireside census, which is great. As I said earlier, at this point, Arrowhead is still closed and we aren't to the point where we're considering opening it yet, because we still do have beds available in fireside. But once we get to that point, that'll be discussed as well. Any questions on census? All right, any other questions for me at all? Okay, that concludes my report.
Thank you, Carmen. If there's no other questions, then we'll get into the reviewing of the vouchers. Does anyone have any questions on the vouchers? And hearing none, Jane, we'll get into your financial report, please.
I'm getting there. Okay, here we are. You can see me. Okay, so let's look at that pool staff report. It is cleared out for the new year. January invoices is what this one is based off of, the amounts paid. There's of course a few January invoices that are paid in February. So it's not a clear, perfect picture, but it's what we have. The trend, of course, is that the CNAs make up the bulk of the pool staff cost, where RNs, not so much, and LPNs not so much, would be the trend, I think, to concentrate on there. Questions on that? Okay, the aging report is a 12-month look back. I didn't clear that out for the new year. We're up a little bit this last month. The Medicare A claims did not get paid in the consistent month that we're used to, so they paid the first week in February, so that throws it off by about $100,000. Some of our old accounts that are with Corp Council are aging, and we're working on those. And then, of course, there's some old claims that we're still working on, but they're not being written off. So, and there's a lot of people on payment plans that some are $10 a month, some are $100 a month, some are $700. So those accounts, as they age, will still go into the appropriate buckets, but they're still active accounts. So it's all still working the way it should. Questions on the aging? Okay, and then
I have a question. How long do those accounts stay open for?
If they're active, we will keep them open. There's one that's older, the person is still a resident, and they're paying $10 a month on a large balance. So we'll keep that open in the case that they get the, COVID money and can pay off a little bit more. That does happen. So we don't want to write them off if they're still able to pay something.
What would that large balance consist? How much money would that be?
I'm not
Give
sure
or take.
offhand. It's at least $10,000.
Oh, okay.
Yeah, and she's paying $10 a month. So, we
Take
could
a
write
lot.
off part of it, but then how do you determine how much?
Yeah.
And if they get a windfall payment of some sort, we want to be able to collect on that.
Even if you write it off, though, you can still collect, correct?
Yes, we can. And I can talk to the auditors about that too. At what point, if at 5 years, we don't think we're going to collect anything else, we could go ahead and write that off, but keep it on our sites. Yep.
Mr. Chair, I can talk to that as well. The accounting standards that apply to this, as far as financial reporting goes, is to the point, it's not a black and white. It's to the point where it feels it's unreasonable or unexpected, more or less. Let's say it's only about a 20% chance of being collected, then you write them off. But as the discussion pointed out, just because you write it off for financial reporting purposes doesn't mean, if there's no legal restrictions or other restrictions that prevent you from pursuing them, if you collect payments later, you just record them again if you've written them off. So, we generally should not be stopping our collection if there aren't legal restrictions, or the people are still around, or there's a means to collect it. So yeah, it's not a black and white thing, but certainly for financial reporting purposes, it comes down to reasonableness of collection.
Totally understand that, Keith. Thanks.
Yep. And there was one account that we sent to a collection agency that has come off of our books, but it's still being actively pursued. So I agree with Keith on that. Any other aging questions? Okay. So the income statement for January, we've updated the budget numbers in that. And if you see, the occupancy is 76% with our goal of 90. So we are, as Carmen said, short on the in-house billable people. We did get another COVID payment that you see in there of $102,000. We did get another COVID payment in February as well. So if you subtract that off the bottom line, you can keep that in mind. We're heavier on the Medicaid side than the Medicare A and private pay. VA is holding its own as far as a payer source. Nursing services on the expense side is down a little bit. I think once that we get a couple more payroll periods in, there'll be months with 3 payroll periods. So this one only had 2. So we're reflecting that as well. And within the nursing services, there's other charges. So maybe we didn't order up so much COVID supplies. That could be. Dietary is okay. They had fewer meals to serve, of course, so their costs are down. Bottom line, I put the depreciation back in at the bottom because it hasn't been posted. The net income shows $134,000. If you take off that $100,000 from COVID, it's down to $34,000, which is reasonable. As you know, it's fluctuating, just being January, and our costs are less than our expense, than our revenue. Any questions on the financials?
Mr. Chair, can I add something here real quick?
Sure, Keith, go ahead.
Certainly. And Jean has done a good job of pointing out the COVID payments. That really is a challenge area for us to figure out what best to report here and what's eligible and not. Earlier this week, we spent several hours in a presentation. The rules are continually changing. The guidance goes from one extreme to the other as far as what it means to lose revenue. My point in bringing this up is that's going to be a very fluid conversation all the way through audit. We're working with our audit firm, Leading Age, everybody possible we can get guidance from on this. So I want to emphasize for this committee, which has the biggest impact on these dollars, all the targeted dollars towards the nursing home, you could see some pretty significant fluctuations. Jane has been doing a phenomenal job staying on top of it, but there's a number of us that are trying to work together to sort through this. So I just wanted to point that out.
Thank you, Keith. I was going to talk about COVID next because I did promise the board I would get a little review, but as it is so fluid, it's, all I can say is we've got a lot of money that came in and we're tracking every expense that we can. And now with yesterday's webinar that Clifton Larson had a presenter, and it was through Leading Age. So they are working together as two big houses of information. I need to work with Carmen and Keith, and we need to have a consensus on what we feel is claimable as far as expenses, because it became more fuzzy yesterday. We thought we knew what we knew, and then there's more information and more interpretation. Yes, it gets more difficult instead of more clear, it seems. But we are tracking every dime that we think can be a COVID expense. And that's the important part, that we're tracking, and once the feds decide what category everything should fit into, we can dump it and claim it. To the point of yesterday, I did sort out some numbers that Chris had forwarded me. The difference between if we had direct staff that called in sick and they got filled with pool staff, what is that increment? And that would be our COVID expense. So we are getting fairly detailed in looking at what is our true expense. Dietary, we went from, total cost for the whole year and then divided it out by meals served. And we have an increase in COVID expense that we've calculated. So we are getting pretty detailed. We're going to keep as much money as we can. And then at the end of the year, the excess will go into deferred revenue, and it may not show up on the monthly sheets anymore, but that's minor. We'll let you know when we know on the COVID expenses, but feel assured that we are tracking everything that we can.
It's a lot of extra work. There's no doubt about it.
There
And
is a lot of work.
We're definitely trying to be as creative as we can, striking the balance of compliance and eligibility, but yet slicing and dicing everything possible. One word of advice and direction given to us, which was consistent with what I was saying early on, is do not returning any of the money. Not at this point until they actually come back. They've already delayed the reporting requirements at least once, if not more. So there are so many moving parts, even at the federal level. This money was pushed out so fast, and they're still trying to figure out what they want to do with it. And I think there's going to be lobbying efforts at some point that there's going to be a lot of institutions and governments like us that have received these dollars that couldn't use them because of all the extra hoops and strings. And they're potentially going to be having a bunch of money going back to them. And there might be some efforts to say, well, maybe we need to loosen this up again. So they're advising us just hang on to it, keep working at it, and we'll go from there.
I wouldn't give it back until they asked real hard.
Exactly.
Oh,
Yeah,
and
I
the
know that
report. Go ahead.
I was going to say, I know that we all really appreciate the efforts you're making on what is a huge and nightmarish accounting task at the moment.
It is a little mini nightmare. We are not sure that, it says June 30th is the cutoff date for expenses. It's possible they'll continue that depending on what the medical emergency is, I guess, in June. The reporting site from the federal dollars was supposed to be open January 15th. We've all registered for that site, but there's nothing there. So all we have is we've got our password and login, got that checked off the list, and that's as far as it is. And there's no talk at the federal level of when that might even be open for reporting. We have, I did say that we have another payment in February that came in. And when these payments come in, nobody knows what they're for. There's a little line on the remittance that Doris gets, it says NH. So we assume that means nursing home. That's as much information as we get. And then we research and get with Leading Age, and then they tell us what it was for. But there's no real communication. They are getting the money out. That's a good thing, but we just have to pick up the pieces on our end.
If I can add something there, we also get checks that are sent to us that just say state of Wisconsin, and how we decided how they came through as the amount and dividing out what possibly it could be from based on the amount of check and figuring out that it's admits or from just distribution. So it's been a process for Jane and her team who have done a great job.
Paul?
Thank you, Mr. Chair. Just a quick question. If we're sitting on money, is there anything that overtly prohibits us from putting in an interest-bearing account?
No, there's nothing that prohibits from doing that. If we give money back, it needs to be with that interest.
So are we doing that?
I
Yes,
have not.
yes, the treasurer is handling this just like all other deposits in our normal banking process with interest-bearing accounts. So yes, we do have to keep track like Jane is doing. And then at whatever point in time that we may hopefully not have to refund, but if we have to return money, yes, there will be a calculation factor.
Thank you.
And I believe that is all I have.
Okay.
For financials and COVID and payroll. Yep.
Okay,
Working
thanks
on
for
those.
all you do, Jane. Thank you. Is there a motion to approve the vouchers and the financial reports?
So moved.
Kelly moves. Do we have a second? We have a
I'll
second from
Is there a
Steve.
second?
I'm sorry, Steve, I got Steve first. So any other questions? And hearing none, all those in favor say aye.
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 Opposed? Carried. Okay. Item number 6B, directional plan recommendation. Yes, Paul.
I'll kick us off. Actually, the first thing I wanted to acknowledge, last night at the county board, we had a question about bed tax. I sent out an email on that this morning. I don't know if you've all had a chance to see that.
Yes, I did.
I saw it.
What I didn't want to burden that email too much with was the observation that it's like any other tax. You can't necessarily know that it goes to anything that it's intended to. I mean, I tried to liken it to if you have a turbine that generates electricity, you can't track where the electrons go. Well, taxes are kind of the same way. The state's going to use it for whatever it uses it for. Bottom line is we have no choice but to pay the tax, and if we don't pay the tax, we're not in business. So, but I didn't know if anybody on this committee had any follow-up questions on that point. If not, executive committee, a number of you are on the executive committee at its meeting in February, discussed the directional plan. We have at least 2, I think, members of this committee who were not on the county board when the directional plan was adopted. I think Supervisor Jensen and Supervisor Kinnear were not. The directional plan is intended to be just that, a plan that guides the allocations of resources and efforts by the county in areas that it has identified as priorities. This is above and beyond, obviously, the day-to-day work that we do, the services that we provide, maintaining and snow plowing roads, or the programs at Human Services, or planning and zoning, or any other department. But the goal is a proactive and open government. This was adopted back in 96, I think it was, Bob?
16.
I'm sorry, 16 rather.
16, yes, 16.
And has been referenced a few times. We made an amendment to the directional plan in 18 when we added broadband. But it seemed appropriate, given turnover in the board and changing circumstances, to revisit it. So executive committee did so and determined that it is still something that we should be utilizing, and we ought to take a look at it, see if we've made any progress, and see if there's any changes we want to make. Of the 10 initiatives or priority areas that have been identified, 5 of them had been migrated to the bottom of a pyramid that was intended to track progress, which doesn't mean that attention and time wouldn't be sent on those other initiatives. But what every standing committee is now charged with doing is taking a look at the directional plan with particular emphasis on the initiatives that relate to the purview of that standing committee, and discuss how are we doing on achieving a policy or taking actions, migrating it up that pyramid of implementation And perhaps in the best case scenario, we feel like we've achieved something. We have a policy and we have programs and procedures in places to implement that policy. And in the worst case scenario, the initiative isn't proceeds as germane anymore and maybe drops off the plan entirely. In the case of the Neighbors Committee of the Dunn County Board, one of the initiatives was the neighbors' viability. And that seems an appropriate place to start. It was not one of the top 5 initiatives identified where particular or first attention was to be given, but it is there and it's appropriate to talk about, which doesn't preclude this committee from talking about any of the other initiatives, nor does it preclude this committee or any other standing committee from talking about initiatives that aren't in the plan right now that maybe need to be added, or ones that are in the plan that maybe, again, are not germane anymore, need to be modified or eliminated. So with that introduction, what we're asking this committee to do is give consideration to the initiatives. Bob will be able to share it if you don't have the directional plan in front of you. He'll be able to share a screen and begin a conversation. And I would recommend we start with the initiative, the neighbors' viability, about what we have done to address that initiative and whether we need to do more or different things. And finally, whether or not the things that we have done or that we plan to do allow us to begin to articulate a policy with respect to the neighbors' viability that we can recommend to the executive committee and ultimately the county board for the implementation of that initiative of the directional plan. So I know that's a lot of planner speak thrown at you. I apologize for that. It's my background. Bob, I didn't know if you had anything to add to my intro here.
Well, the only thing that I would add is maybe just how the pyramid is intended to work, Paul, just so as they pick, for example, you talked about the neighbors' viability, if they're working on that initiative, and even if it isn't on the face of the pyramid, doesn't mean that you can't be working on it. But the plan was intended, and if I could share my screen right now, it might be easier. So can everyone see my screen first of all?
Yes.
Okay.
Yeah.
All right. So let's, the 5 initiatives that are on the bottom, and then above that, there's some values, and then there's our goal of proactive government, and then our vision of, of providing quality service that protect and empower our citizens in a cost-effective manner. So let's take, for example, because we're here with the healthcare center, that the neighbors viability is initiative down here. Develop a neighbors viability policy. And there's a lot of work that you guys would a statement that said this is what it means to us, and this is what we're going to do. But one of the ways that that we figure out is when you do that initiative is that we want to be able to compare it to these 4 pieces here. Quality of life, board engagement, public engagement, and sustainability. And if I scroll down to at least in the plan, so that you understand that these are defined, so that you understand where they are. So, when we're talking about sustainability, there's a definition of what sustainability is, and board engagement, and public engagement, and quality of life. The intent is that when you're drafting a policy or things towards a policy, is that you gear them towards meeting these 4 value statements. And once you have a policy, I think that it's important that it becomes known to the rest of the board. And I don't know the real procedure, Paul. You may want to talk about that in terms of what constitutes a policy, and then when we can say that it's finished and can remove it off the plan and move on to something else. So, but I just wanted to kind of work with the group on the mechanics of the plan, because it's a very simple plan and a lot of stuff is in there. and I get it. It's simple because, as Paul said, you know, I was part of the drafting of this, and so it makes perfect sense to me. But it was intended to be a fairly simple plan to navigate and to work on. But if there are questions, I'm certainly here as a resource, as is Mr. Miller. So with that, maybe I'll just turn it back, and unless there's questions of me particularly. And should I stop sharing now?
Leave it up for now, Bob.
Okay.
So the last thing I guess I'll say before we turn it over for your discussion. The point of a policy is a relatively brief statement that expresses a value, and it should be crafted in terms of the 4 value statements here with those in mind, not to necessarily utilize those words, but with those in mind. A fairly simple statement that expresses a value that has the effect of causing certain practices, programs, and processes to implement that policy. So the challenge that I think we should start with here at this committee is, are there already things that we are doing related to the viability of the neighbors that are already sufficient to allow us to say our policy is that, for instance, the county should always devote the necessary time and resources to assuring the neighbors of Dunn County remains a viable institution and service to the citizens of Dunn County. Right? I've just made that up off the top of my head. That's a policy statement, but what does that mean? Well, it means the things that we have been doing for neighbors viability, including our outreach to the community. Hey, we're the neighbors. We're trying to maintain the 5-star rating, maintaining good working relationships with our healthcare providers so that we become the primary or first reference site, trying to maintain staffing, trying to advertise to potential staff the benefits of working here, et cetera, those kinds of projects. Have we done enough of those, or do we need to do more? So Bob and I could probably go on and on. That's not what we're here for. We want to hear from you.
Paul, I was just wondering why is there anything else in the plan that pertains specifically to the neighbors? I understand broad ones will, but why viability, and I shouldn't say who, why was it brought up? Why was it put in here? Because of financial?
I suspect, I wasn't here either, Chairman Johnson, when the directional plan was adopted, but I suspect it was put in there because of the controversy that was in place when the neighbors was approved by the board. You were there, I think, and
No, I was not.
You were not. Okay. Certainly, Chairman Bartlett could tell you about the battle that went on about whether or not we should do the neighbors at all or stick with the old skilled nursing facility. I wasn't here for it, but I saw a lot of the bloodstains from that fight. So I suspect that the reason that it was included as one of the initiatives was to reinforce and help confirm the wisdom of having gone the route of the neighbors rather than not having done so. And recognizing that it was a huge investment monetarily for the county to undertake. It's a debt burden that we're still paying off and will be for some time. It was very controversial at the time the decision was made. So trying to assure that it is a viable concern going forward that provides a valuable service to our citizens is one of the things I think naturally was included, given the timing of the directional plan versus the timing of the neighbors.
Okay, Kelly, you must have been on the board at the time. Do you have any insight on thoughts?
Yeah, I think that I will defer to Dave if he wants to take the question, but that is the way Paul framed it is essentially what happened. I joined the board right as the issue of the neighbors was being framed. It was huge hours and hours of battle, debate, I think 6 members of the board lost their seats over the vote on whether to go forward with the project. It was delayed long enough. It was originally going to be funded by the Obama stimulus plan, but the debate continued long enough that those funds, that funding source expired, and finally there was a debate about how to fund it via debt that ended up the project was scaled back a little bit. I believe we were originally going to have 4 neighborhoods, and the debt and the way we financed the debt was part of the argument there. And then for at least the first 3 years after the project was up and running and the debt had been financed and we were in the building, it continued to be a huge source of debate and argument. And there were a number of supervisors, I think all but one of whom have left at this point, who were very concerned that the Neighbors was not going to be viable in the long term. And we're trying to convince the county to get out of the business of having a healthcare center entirely. I know Steve Rasmussen was a driving force in putting the Neighbors project together, and he wanted a very strong emphasis on why it was a good idea for us to be in this business. And I believe that was exactly how it landed. I think that probably adds most of the context that Paul was not here for. I'm happy to field questions on any of the process that I can remember.
Dave, do you have any comments?
Both Paul and Kelly were spot on with the controversy of putting the Neighbors project together. I believe that the accounting things that we went through when we found out how things were being accounted for the Neighbors' debt had a lot to do with trying to make them pay their own way and to make sure that additional tax levy did not go on to fund them. And yes, that's why it was put in the directional plan, was because it was felt that it was so important that they were sustainable.
Okay, thanks, Dave.
Brian?
Yes, Sarah? Sarah, are you there?
It was a long, hard battle, and it took a long time to get the Neighbors going and built. The county had to have 2 referendums to try to get support from the community, and they passed overwhelmingly that they wanted to keep the nursing home. So it was not easy to get this going, and I give a lot of credit to Steve Rasmussen and Gene Smith that we ever even built the Neighbors. That's all I have to say.
Okay, thanks. Well, I know the discussion is still out there, even though it's been that many years ago when it was built. The discussion is still out there in the public eye. To be honest with you, how do we maintain the viability of the Neighbors, I think, is an ongoing deal. And I feel as if the Neighbors are making great strides, but I don't know if it should be pulled out of there. But I'm just throwing it out there. Anyone else have thoughts on it?
If I may make a suggestion, Mr. Chair?
Yes. Yes, sir.
I think it would be helpful to the committee if staff takes a stab at articulating clearly the efforts that we have already made and continue to make that are related to the viability of the Neighbors. And in addition to pulling that together in a report that you can read, review, take a stab at drafting a policy related to the viability of the neighbors, which we can then present to this committee at its next regular meeting for further discussion, refinement, thumbs up, thumbs down, and then aim at forwarding that to the executive committee, whatever comes out of that, subsequently.
That sounds like an excellent idea. Anyone have any other thoughts?
I'll just add that I'm willing to volunteer that because I know Carmen has nothing to do, so she'll be all over that. No, in all seriousness, it's not something that I would expect Carmen or even her staff to do alone. We clearly will need their input, but I suspect it falls more on me and Bob Colson to help facilitate the drafting of that.
That sounds good to me. Anyone else have any? Kelly?
That sounds structurally like a good way forward on this. My main comment is I think that we have gotten to a place where we have a pretty good process moving forward with the neighbors, keeping it viable. I, for one, would love to see us draft a simple policy, essentially ratifying what we're doing and moving forward with that, and then getting that out of our priorities for directional plan, because I think we're basically at a place where the viability structure is pretty good, and articulating the plan would allow us essentially to cross something off the list.
And I'll add that I agree with Supervisor McCullough. I will add that crossing something off the list doesn't mean it's done and we give it no attention. It means, in fact, that we have a policy and it is resulting in actual devotion of resources, time, programs, policies, approaches, et cetera, processes. It means that it's something that we're actively doing.
I agree. Bob, you had something?
Yeah, two things. I'd like to just reinforce what Mr. Miller just said. You know, you have a policy. I mean, it should be based on whether, you know, it improves quality of life. You know, if there is board engagement ongoing, if there's public engagement ongoing, and that was something that was brought up in terms of people not understanding or thinking what's going on, but keeping the public involved. And is this something that is sustainable? You know, in terms of can we do it? Can we continue this tomorrow and into the future? So I think those are important pieces. But the other thing that I wanted the group, as long as we're here, is to talk about is that there are 10 items in the directional plan, and one of them pertains to the neighbor's viability. Are there other things besides this that you think are important for the neighbors going forward that we need to consider, that this group needs to consider in terms of what next? You know, that's another important piece of the plan, because if we work through the 10 and there isn't an 11, I guess we've reached the goal.
Yeah, that's a good thought. There is supervisor education that should always be ongoing. There's no doubt, and communication. With this COVID, this is just, these Zoom meetings are, I think, getting to me, but number 9, I think, should always be ongoing. I kind of read down them here as we've been talking. Anybody else have any other thoughts?
If I may, Mr. Chairman.
Yes.
So I will suggest that as long as we're giving staff homework to do, that we give committee members homework to do as well. And that is, take a look at the 10 initiatives that are in there, and then give some thought as to whether or not there are additional initiatives that aren't there. Give some thought. Now, that doesn't mean that you are required to come up with any, but give some thought, to actually devote some time as elected representatives as to whether or not there are other areas that we really ought to spend some time and resources that may coalesce into a new initiative that we can roll into this planning process. And those can be talked about at the next meeting as well.
Excellent idea. Sounds good. So if we're gonna go forward with staff looking at the viability and letting us know, I don't imagine we need any, we don't need a motion on that or anything like that.
Not at this time.
So anybody have anything else on the directional plan discussion? Sarah?
Well, I had a copy of it years ago and I don't have one now. Could those of us on this committee be sent, you know, an update on it or a copy of the new one or whatever?
I'll take care of that, Paul.
If we had been doing our job, you would have had it already. Supervisor Kennedy, apologize for that.
Thanks, Bob. So does anybody have anything else? I'm sorry I don't see all of you, so you'd have to yell at me. Mike, I haven't received from you.
Stop sharing your screen, Bob.
Oh, thank you. It's not all about me.
Mike, you have anything you want to say? I couldn't see you. You weren't on my screen.
I'm sorry, I forgot to say this earlier, but Chris, I want to thank you for the minutes. That they really helped me keep in mind what happened before. And I forgot to mention to Carmen, I know that you applied for the ability to have a CNA teaching spot there, and they're busy down there. Well, I suggest you be the squeaky wheel. We look at, it's the CNAs that cost us the most. Just keep bugging them, keep after them, because we have someone that could teach. Is that correct now? I think we have someone that volunteered to teach, but keep
We have
after
a
them. If we
couple
could get,
people that would be interested.
so, yeah, so keep after them. Don't give up. I know Paul keeps giving you extra things, but I think you're doing a great job. But thank you very much. But
Actually,
We can
Supervisor
wheel.
Kinnear, that's exactly the kind of thing that would be included in the list of programs and processes that will help implement a policy of neighbors viability. That would be one element.
hey, I knew that. Yeah.
We did take one step in the right direction there. We haven't had our own program yet, but we will be a clinical site for CNAs soon. So that is a little bit of a step in the right direction there. We haven't gotten the go ahead to start our own program up again, but we are a clinical site for nurses and we will be for CNAs soon. So Paula has worked with, I believe it's CVTC for that. So we have, we'll have people training in the building as CNAs very shortly. So that'll at least have people here too.
Yeah, you got to blow your own horn a little bit. That's a good job.
Kelly.
So where it's the state that we need to talk to about getting that moved forward?
So we have to apply to be a training program, and there's a process for it, which I submitted the first part of the process and didn't get anywhere for it. So like Mike or Supervisor Kinnear said that keep reapplying. So I'll do that right after this meeting. I'll send in another application for that. I don't know if we got missed or how that works, but I do know they are working really hard at doing emergency training programs, which are a different thing, which we could apply for that as well. But I would much rather have a permanent program because those emergency training programs will not be extended after the pandemic ends. So if we can get a regular program going, that would be great as well.
Okay, yeah, one of the reasons I brought that up is on our special meeting on the 22nd, we will have the ear of our state legislators and state senators, and it might be something to ask them to nudge the state about.
It could only help, I guess. It is just one section of the state. I do know that the person who does it, she is the only one, so she might just be overwhelmed. They only have one person that is the state's person for starting up and being the training program person. So I don't know if they would be able to help, but I mean, it can't hurt to ask.
Great, thank you.
Mhm.
Bob?
Yeah, just one thing. I think that, I report to several committees and for example, directly to PRD, and on the directional plan. You know, they have the environmental policy on water quality, and I bring this up only to say they have done a lot of work on that, and I don't know that they really sat down and just wrote down what it is they're doing. I suspect the same is true with the neighbors, that there's a lot of things that you guys have been doing that just haven't made it to pen and paper that you can bring forward towards you know, meeting what you've already done. And so I think you'll be surprised once you put some thought into this as to, you know, just what you've all done already, which is also going to maybe help in terms of generating the policy, just to kind of understand just what you've done and where you're going. So I would say pat yourself on the back. I bet you're going to find you've done quite a bit already.
Okay, anyone have anything else at all? And hearing none, don't forget, supervisors, we have homework now. I'll adjourn the meeting. Have a good day, everyone.